For our Challenge Nova Scotia 2017 problem, we'll be concentrating on how to attract more family doctors to Nova Scotia, as well as create greater continuing care access. What's being done already? The government, Department of Nova Scotia, and Nova Scotia authorities are communicating with the public, looking at ways to increase primary care to Nova Scotia by incentive packages to encourage family doctors and nurse practitioners to go to underserviced communities, and the establishment of collaborative care clinics. Despite these initiatives, there is still very few attraction of family doctors taking on comprehensive primary care practices. This week, I spoke to a few doctors in private offices, and the feedback I received about attracting more doctors to Nova Scotia and creating greater continuing care access were that some of the problems involve inadequate payment for services provided, a lack of the increased complexity of patient care of patients, and a lack of recognition in the time taken to provide adequate care to patients. According to Statistics Canada, as many as 90,000 Nova Scotians don't have a family doctor. Currently, it's estimated that the per capita number of family physicians in the province could meet the needs of the patient population. What this means on paper is some of the province have enough family doctors to meet the needs of the population of these areas. But not all of those family physicians, however, are providing comprehensive patient care. Some physicians are choosing to provide solely walk-in or episodic care. Our first problem we will tackle is that currently family doctors are paid the same for an episodic short visit as they would for a comprehensive visit in most cases. So, one solution to the family doctor shortage and creating greater continuing healthcare access would be to de-incentivize episodic practice. A change in the fee structure resulting in lower payments for walk-in visits compared to complex comprehensive care visits could encourage more physicians away from providing only walk-in care towards taking on responsibility for the long-term comprehensive care of a patient population. Problem number 2. In 1992, the average office visit with a family doctor took between 12 to 15 minutes, and the average now is over 23 minutes. This is due to a number of factors, including increased aging population, higher disease complexity, more mental health issues, and more stringent requirement of licensing authorities regarding documentation and standard of care. The fees paid to family doctors have not taken into account the extra time to provide services. So a solution would be to develop a fee system that compensates physicians for the time spent in 2017 and so on. This would require paying higher fees to family physicians for routine office visits. The last problem we will tackle is that most family doctors are self-employed and have to pay for their own overhead, which contains electronic medical records, heat, equipment, staffing, which includes paying salaries, pensions, etc., and even more. Back in the 90s, overhead per physician was about 25 to 35%, and after speaking to a few physicians in our local area, they stated that overhead is now up to 70% for some. A solution would be to recognize and reduce fees and overhead. Our recommendation is to de-incentivize episodic practice, as well as reduce fees and overhead, and recognize the need of higher payments for physicians in routine visits and change the structure to compensate. We are in dire need of more physicians and greater access to them, and I believe all these strategies will definitely attract more physicians to Nova Scotia and at the same time help immensely with creating greater continuing care access.